How long do veneers last? Question mark. Underline. New paragraph. Porcelain dental veneers have not been around in dentistry for that long compared to other types of dental treatment such as silver fillings, gold fillings, crowns and dentures, full stop. When dental veneers first came out around 25 years ago, they were a major innovation in dentistry, full stop. As is usually the case, dental veneers were initially researched in the UK dental schools, and one of the first dental schools that started doing research on this type of treatment was at the London Hospital Medical College Dental School, full stop. Once research had been done on them, the dental hospitals started to use veneers on patients who were under care at the dental hospital itself, full stop. Once these initial cases had promising success, scientific papers were written up about them, and fairly soon afterwards, they started to be used in the high street practices, full stop. Even when dental veneers were available for general dentists to use, over 98% of dentists did not really use them, full stop. The reasons for most of the dentists not taking up this new technology was that they hadn't been taught how to do porcelain veneers when they were training at the dental school, and therefore they didn't feel confident in using veneers on their patients, full stop. Of course, you could have done reading on research papers and also read the latest articles, full stop. When dental veneers first came out, there weren't many courses, in fact there were no practical courses available for dentists to go on, full stop. Another important reason why the vast majority of dentists did not use porcelain veneers on their patients is that they were not readily available on the NHS, and at the time when they came out, over 95% of all dental treatment was carried out on the NHS, full stop. Over the next 10 years, more scientific dental papers came out, and they started to make dentists more aware of their advantages, full stop. A really good example of where porcelain veneers could be used was in the case of a condition called tetracycline staining, full stop. The spelling of tetracycline is TETRACYCLINE. Tetracycline staining was quite common in patients born between 1960 and 1972, full stop. Tetracycline staining occurred in patients who, when they were very little, at about 3 to 5 years of age, became ill, and when they went to their doctors, the doctors gave them an antibiotic called tetracycline, full stop. The illness that you may have had need not be anything severe, and many of the cases were just where somebody had a cold or a sore throat and were given antibiotics, full stop. Of course, back then, it was usual to give antibiotics to treat a cold, even though nearly all colds are caused by a virus and not a bacteria, full stop. Patients who had tetracycline staining on their teeth, had different levels of disfigurement from mild to severe, full stop. If you went to your dentist asking for advice on how to make your teeth better because they had been stained when you had been taking this antibiotic when you were little, the only available treatment was to carry out crowns on all your teeth, full stop. It became quite common for patients to have nearly all their teeth crowned in order to improve the appearance that had resulted from the tetracycline antibiotic, full stop. The reason why tetracycline antibiotic discolored the teeth was because when the child took the antibiotic, the enamel of the teeth was still growing and the antibiotic molecules got absorbed into the enamel that was developing, full stop. This caused the enamel to be abnormal because an extra molecule became absorbed, and this resulted in the subsequent staining called tetracycline staining, full stop. So what has this got to do with porcelain veneers? ? To have crowns done on all your teeth was a very major task, and it would result in having your teeth trimmed down quite extensively in order for the crowns to go over your teeth, full stop. From our section on crowns, you will see that crowns can have problems in the short term and also in the long term, so they are not always an ideal form of dental treatment, full stop. Porcelain veneers were one of the treatments that eventually replaced having crowns done on all your teeth for tetracycline staining, full stop. Later on still, tetracycline stained teeth were treated by having a combination of laser tooth whitening and porcelain veneers, full stop. Fortunately, it is now quite very rare to have tetracycline staining treated by your dentist, because either those patients have already been treated, or because those patients are now approaching midlife and they are not bothered anymore about the tetracycline staining, full stop. New paragraph. Porcelain veneers were a major innovation in dentistry and still continue to be widely used, full stop. The main ways in which porcelain veneers have evolved compared to when they first came out 25 years ago are in the tooth preparations used, the bonding technique, and the type of dental porcelain used, full stop. In addition, dental porcelain veneers can also be made in just one visit using a porcelain milling, milling machinery, full stop. New paragraph. Porcelain dental veneers are used for a wide range of circumstances and conditions, full stop. These include, comma, changing the colour of your teeth, comma, changing the position of your teeth, comma, changing the shape, and to build up a tooth or teeth which have broken, full stop. New paragraph. Porcelain veneers are generally limited to the top front 4 teeth, although they can be used on the canine teeth as well, full stop. Further back than the upper canine teeth, comma, it is not very common for a dentist to use the back premolar and molar teeth for porcelain veneers, full stop. More than 80% of all porcelain veneers are placed on the front 4 top teeth and relatively few on the lower teeth, full stop. New paragraph. How long do dental veneers last? Question mark. Underline. New paragraph. The 3 main factors which determine how long dental veneers last can be put into 3 main headings, full stop. New paragraph. Dentist's skill and dental factors, underline. New paragraph. Patient factors, underline. New paragraph. General wear and tear, underline. New paragraph. Dentist's skills, underline. We can label this number 1. New paragraph. Out of all the above 3 factors, comma, it is the dentist's skill that will really determine how long your dental porcelain veneers will last, full stop. Sub-paragraph, label this the letter A. Assessment, underline. Here we can use the term inverted commas if you fail to plan, comma, you will plan to fail, full stop, close inverted commas. The assessment that the dentist carries out is extremely crucial in determining how long your dental veneers will last, full stop. An experienced cosmetic dentist, comma, will go through a long list of assessments that need to be carried out before even considering if porcelain veneers will actually work for you, and even if they are the right treatment for you, full stop. If, say, a patient has a habit of grinding their teeth at night or clenching their teeth in the daytime, this will almost certainly be a contraindication to providing dental veneers that will last, full stop. This is because dental porcelain veneers cannot take up the heavy, unnatural biting forces of clenching and grinding of teeth unconsciously, full stop. Although, placing veneers on a patient who clenches or grinds, is not recommended, it may still be able to be carried out if you address the problems of the clenching and grinding, full stop. One way around this, is to have a night guard made which the patient wears in order to minimize any destructive excessive forces on the porcelain veneers, full stop. The assessment appointment will include a long list of factors to check, but also X-rays will be needed to make sure that the teeth are healthy enough to have porcelain veneers on them, full stop. New paragraph. Subsection B. Tooth preparation techniques, underline. Although a porcelain veneer can be extremely thin, nevertheless, it still has a certain thickness, and therefore the underlying tooth enamel will need to be trimmed back in order to accommodate the extra bulk of the veneers. Otherwise the tooth can look more bulky than what you started off with, full stop. With the tooth preparation, the two factors involved are the amount of tooth preparation, but also the way in which the tooth preparation is carried out, full stop. You don't want not enough tooth preparation to be carried out, because that can make the veneer bulky or even too thin so that it fractures later on, on the other hand, too much tooth preparation is really bad as well, because it can reduce the amount of enamel for bonding later on, but also it can weaken the tooth, full stop. A good, careful dentist will use something called a, inverted commas, putty, P-U-T-T-Y, index, inverted commas, to accurately gauge the correct amount of tooth preparation that needs to be carried out